Hi, thank you to everyone for joining us for today's session of Health Tech Thursday. Today's session is Chronic Care and Prevention. Presented by the CSE and KASCorp, we are pleased to have 3 companies and 1 guest moderator. Scott Montgomery from WellteQ, Lynda Brown-Ganzert from Curatio, and Jeff Ruby from Newtopia. We also have a guest moderator, Mark Kohler from CloudMD. This represents today's stunning and fine lineup. Our objective in running Health Tech Thursday is twofold. First, to help digital health technology companies gain visibility and traction on an accessible platform. The second is to help capital markets players and companies in this space by introducing them to interesting companies, focusing on whether the technology will have commercial traction and why, and also providing new knowledge of what is happening in innovation. As for you, the attendees, we do ask that you share ideas and feedback with our presenters. Leads, possible funding after due diligence, referral of someone with unique applicable expertise, or maybe even a potential strategic relationship are all encouraged. You can find their contact information in the chat board if they so choose to put it in. With respect, we might refrain from giving management advice unless we are truly expert in the company's particular field, and don't treat our presenting companies as marketing targets for their services. Some housekeeping matters. You will note a red Reconnect tab at the top of your screen if you lose audio. Just click it and you'll be reconnected. In the event that there are technical problems, we may hit the restart, in which case there's no action required by you. The system will automatically reconnect everyone. We aim to keep the show running for 45 minutes to an hour. The chat board may be utilized to ask serious questions. Please be clear as to whom your question is being addressed. We have a disclaimer. I'm not going to read it. I'm going to post it in the chat, but it's the usual. Each company will have a 6-minute presentation with their PowerPoint. When you see my face appear, along with Jason's, the company has 15 seconds to wrap up. After all the companies have presented, we will move to our Q&A. Today, we're privileged to have Mark Kohler from CloudMD as your question moderator. And with that, I turn it over to co-host Jason Baibokas from KASCorp.
Thanks, Barrington. Thanks for everybody coming out again. Just for the folks that weren't here last week, I run KASCorp, which is essentially a merchant bank based in Toronto, and we look to partner with entrepreneurs and help leverage our background and our experience to help grow those business and help them out from a capital market standpoint. A few years ago, and particularly at the beginning of this year, we recognized that the health system was one of the largest sectors of the economy that has seen the least amount of digitization. And we felt it important, particularly now in a COVID environment, to really help educate investors and the population at large as to some of the changes that are happening. So we partnered with the CSE to put on this series of events. Our first speaker for today will be Scott Montgomery. This is a bit of a unique flavor. His company is based out of Asia Pac, and he is an exercise physiologist by training, a passionate professional with an entrepreneurial track record, demonstrating vision and success over the past 15 years. He's accrued experience from a variety of clinical settings, workers' compensation, insurance, workplace solutions, and helped co-develop Australia's largest workplace well-being company to an 8-figure exit in 2012. He has over 10 years experience as a business leader across Asia Pac and is now spearheading WellteQ with a focus on engaging people using health technology and improving businesses with data analytics. And in doing so, WellteQ's becoming a very fast growing, globally recognized wellness company. And with that, I'll let Scott take it away.
Thank you, Jason. Thank you, Barrington, and the CSE more broadly, and KASCorp more broadly as well. It's a fantastic opportunity to come and speak from down in Asia. It is the wee early hours of the morning here, and we've got some fairly strong momentum that's expanding from this region up into the other parts of the world. And I just want to share very quickly over the next sort of 5.5 minutes what that story is. We're a digital health platform. We operate for employers and insurance companies at the moment, and we're helping solve the problem that the medical system is in need of an injection of innovation, and specifically that the acute medical care does not prevent chronic illness. We get broken, we go in and get patched up, and we leave again until we get broken and come back in. It does not solve the root cause problem. The other aspect is that health information alone does not typically prompt change. It needs to come repeatedly. It needs to become personalized. It needs to be very specific to an outcome. And that's where we have built technology utilizing the tools of artificial intelligence, of machine learning, content distribution, and taxonomies to help people with ongoing, specific, and personalized support to coach them for these outcomes. So our experience is through a smartphone. We help profile people via different questionnaires, so self-reported information. There's wearable data collection that comes in as well, and we have the ability to take a photo on your mobile phone and help understand your body fat percentage, your body circumference measurements, or phenotype, or your physical appearance, alongside attitudes, mental health, clinical instruments, and employee engagement, as well as history. So we have a very good understanding broadly of what has brought you to this moment in time. And then over time, we leverage rewards, we leverage gamification, we leverage personalized coaching, all towards understanding the profiling system from the software then helps to engage people through a variety of different tools, and that might be exercise delivery, it could be nutrition delivery or inspiration. And then we can escalate into telecare. So for that risk segmentation, we can then turn that up in the support. And we do that through a partnership model, which allows our multi-country distribution. So we have been operating for a number of years. We're 6 years of operation. We're agnostic to industry. We quantify health outcomes and ROI back for a variety of employers. And we white label for insurance companies and large employers as well. We've been forced by the sheer location of where we are that we're now multicultural, we are multilingual, and we're deploying in 13 languages, well over 30 countries. That figure's increased in the past month. So we are the definition we're striving to be, that localized international platform. We are multicultural. We do factor in diversity, and we're bringing innovation and distribution from Asia out to the rest of the world. Our continuum of care is expanding. So traditional corporate wellness has been working with employees and insurance and policy holders, and more of an engagement and a prevention function. And then in the sophisticated technologies, we can then segment and then escalate care directly or via partners. The extension of that goes into a condition management function, and then into remote patient monitoring for connected outpatient functionalities. And that's where, at the time, where the healthcare system globally is still not enough to cope with chronic care. So we've got to get ahead of this problem. We've got to do that through personalized coaching, and it's increasing agency and incentivization in the individual to take ownership themselves. The growth path of the company starts in a $50 or $60 billion industry in corporate wellness that has grown a lot since COVID. Through social distancing and working from home, employers are now even more motivated to offer a health-focused benefit or support to their employees. By white labeling and work for insurance companies and having distribution agents as partners for us and insurance brokers, we work very closely with the insurance sector as well as the corporate, and that helps offer us a very good data-driven insight into risk and cluster and trend and predictions, and we're able to then personalize or target solutions for different personas or for different regions. So some departments may be sleeping less than others. There may be a higher anxiety risk in other departments, and we can start to target content and program offering to to specific cohorts. And then through that segmentation, we can escalate primary care to people in the comfort of their own armchair or the comfort of their own car when they're on the way or commuting to or from, well, obviously not driving, but somewhere where it's private. They don't have to go to a sick room. And we bring utility to telehealthcare. So it's a very hand in glove relationship for our partners. And that is the new way of healthcare. Now, we can span into countries relatively easily as an unregulated space, and then we go very deep with this model. So there's an overview of the WellteQ business. Very grateful for your attention, and looking forward to speaking and hearing from the other experts on the panel this afternoon. Thank you.
Well, thank you so much for that. And we encourage our audience members to please use the chat board. If you have questions, feel free to submit them. But no, that was great. Next up, I'll leave it to Jason. I'm going to load Curatio's presentation. So
yeah, our next speaker is none other than Lynda Brown-Ganzert. She's the founder and CEO of Curatio, a digital health platform used in over 100 countries that combines AI and matchmaking to deliver private social networks to patients that drives adherence, self-management, and engagement that results in improved health outcomes, lower costs, and better system utilization. She was named a top 10 woman in digital for 2020, Startup Canada Entrepreneur of the Year in 2017, and top 40 under 40. Wondrous Wired Woman, Global Venture Clash winner, and this list goes on and on. She holds the title of Chair Emerita for Simon Fraser University and is Director of the Canada Foundation for Innovation. So without further ado, I give you Lynda Brown-Ganzert.
Thank you so much, and thanks everyone for joining us today. So I'm happy to share some of Curatio's story and our mission of No Patient Alone, and delighted to be co-presenting today with the other panelists. So if COVID's shown us anything, it's that we're all humans, are social animals, and we are certainly craving that social connection now. And social has a very important role to play in healthcare. Now, when we think about mainstream social and, gosh, about the 3.8 billion people using mobile social, it just isn't designed for healthcare. So whether it's data breaches, privacy issues, retargeting, false information, difficulty in navigating, mainstream social just can't be used for healthcare. And when they're left out of that, when healthcare can't use mainstream social, which is the case, they're at a real loss. So they can't deliver support at scale. They can't use scalable, personalized privacy and regulatory compliant technologies. They can't get the return on investment that they would gain from things like being able to do distributed care, data insights, and contextual understanding of those patient populations. They're missing out on better understanding the patient populations and delivering that just-in-time support. And increasingly, they can't gather the real-world evidence that they need for payer systems, and particularly in the US, but where they need to show real-world evidence for efficacy and reimbursement, they've got a real lack of data there. And finally, with the patient in mind, they don't have a long tail engagement. They're prevented from having a relationship with people who are, 50% of the world's population are using mobile social on their phone every day, and they can't be a part of it. Healthcare can't be a part of that. So we solved that problem. We built a privacy and regulatory compliant platform that any healthcare organization can use as a type of social plugin. We are privacy compliant worldwide, so HIPAA, GDPR, PIPEDA, and regulatory compliant, which means we can do adverse events and pharmacovigilance filtering. We are used in over 100 countries now and available in 20 languages. So we've had quite a large global expanse. And let me walk you through sort of the use case or what the patient experience would be. So here's Elena, and she's living with ischemic heart disease. She onboards and can be prescribed the platform, or she can also discover it in an open sponsored way. So we're doing both white label and open sponsored varieties. She meets our AI buddy that can be configured to any condition, any partner. She goes through conversational onboarding, which helps us complete her profile, and we're using machine learning in the background to better understand where she is in her journey, what she's needing at that point in time. And then we introduce her to matchmaking, which is dynamic and refreshes every 24 hours as we are understanding more of her profile. And Elena gets to create her own private circle that is truly unique to her, as well as be matched that she can use that show how she's doing each day, and she can use that for her own tracking, or she could share it with her provider. We have community managers in-app as well as machines. So we're using a human and machine mixed model in terms of personalized support, and she can participate in research. Additionally, we've integrated this year Curatio Meets, which is our virtual visits tool, and we've partnered with CloudDX on doing advanced remote patient monitoring, which means that hospitals can use this and send their patients home with us so that they can do safe and regulatory compliant monitoring from home. Now, at the end of the day, for our customers, this gives them a unique data insights and contextual understandings of their patient populations that they don't have. We call it real-time, real-world evidence. So we allow them to use social in an incredibly powerful way that builds a relationship directly with their patient populations and gives them very important insights that help them deliver support when and where it's needed. We are a SaaS model, so the platform itself is agnostic. We're working in chronic conditions, rare conditions, lifestyle, mental health, neurological wellness. The platform itself is, you can think of it a little bit like Slack for healthcare. So it's a SaaS model. We are typically into multi-year agreements with our customers, and the majority of work that we are doing is white label, but we'll also run sponsored communities for folks that are looking to grow and acquire their patient populations. We've had incredible growth. This has been a very busy year for us, and the reason our customers are using us is fourfold. So one is around patient acquisition. So that is increasingly important in terms of acquiring and having a value add for the patients they're working with. The second is around adherence, and I think as Scott said earlier, health information on its own won't impact health outcomes. So bundling this solution with adherence is another way that customers are using us. As well in terms of retention. So increasingly, what is the value add for patients and how do they retain them? And then as mentioned, that real-time, real-world evidence. We're having some fantastic outcomes, great overall satisfaction. We have published clinical evidence on the efficacy of our solution. And I think when we're looking at the year ahead, and I know we'll get into this in the question side, we're seeing telehealth grow substantially, and we'll continue to see that for the year ahead. Telehealth itself is very transactional in nature. And so you need that social front end to make it an ongoing, almost like subscription model. And if we're going to address things like quality, costs, and access, then you need to look at engagement and you need to look at the patient experience. So we're on a real race to win hearts for patients, and this incredibly booming area of digital health is really looking at, who's going to have the patient relationship. So that's what Curatio does. We help strengthen and build patient relationships directly with health organizations. Look forward to the discussion.
Thank you so much. We definitely appreciate that, and I encourage our audience to not only ask questions in the chat, but also share the links, because this is going to happen again next week as well. You can find last week's presentation on CSE_TV available on YouTube, and this will get posted. Today's session will be posted in our CSE channel as well.
So our next speaker is none other than Jeff Ruby, founder and CEO of Newtopia. Jeff's a health innovator with an extensive entrepreneurial track record in preventative health. Newtopia is a precision health company for sustainable habit change and disease prevention. Jeff has a JD and an MBA from Osgood and Schulich, and a bachelor's arts degree from University of Western Ontario. He's a global thought leader and expert on integrative, hyper-personalized, and highly engaging strategies to deliver proven, scalable, and sustainable habit change. And with that, I'll let Jeff tell you a little bit about Newtopia.
Great, thanks, Jason. Really, really great to be here with you all today. I've been innovating in the disease prevention space for about 20 years after losing my dad at a young age to cancer and coming up with a realization that what we call healthcare has very little to do with keeping healthy people healthy, and it's almost everything to do with monetizing illness. And I'm just a believer that where financial incentives go, so does activity, and healthcare counts on us all getting sick or no one gets paid. And I think that's fundamentally backward. So what Newtopia is all about is we're a tech-enabled disease prevention company focused on healthy habit change. We prevent, reverse, and slow the progression of chronic disease while enriching mental health, resilience, and optimal human performance. And what we're focused on are pre-chronic populations. So we're looking at individuals who are pre-obese, pre-diabetic, pre-heart disease, pre-stroke. That accounts for roughly 50 to 60% of the North American, increasingly global population. And what we do is get to know those individuals really, really well through a combination of genetic, social, and behavioral data. So we can turn around and design experiences that blend the best of human with the best of digital, all on a proven habit change framework, whereby we are looking to reduce those risk factors and prevent the onset of those conditions, all in partnership with whoever's risk-bearing. Our current focus is on risk-bearing insurers and employers in the US, but we believe that there's great opportunities beyond that group. And what we've been able to demonstrate for our partners is not only keeping their membership healthier, but also being able to significantly reduce their costs with a proven ROI to them, and most importantly, deliver outcomes that grow over time. And we see outcomes that grow over time as the ultimate value add for everyone, all the stakeholders. But what it requires is this focus on habit change, which is one size fits one in nature. And it differs considerably from kind of what everyone else is doing in the prevention world, which is largely learning and education based, which is one size fits all in nature. And we spent a considerable amount of time proving the efficacy of that approach. As a health tech company, we spent a lot of time in the health outcomes world. First, before commercializing, spending 3 years in a large-scale randomized control trial where we wanted gold standard data, the same way that any drug is proved out on the efficacy of our habit change platform. We partnered with Aetna in 2013 to 2016 to achieve it. We've published peer-reviewed journal articles supporting it. And what we've demonstrated is industry-leading outcomes with regard to clinical risk reduction, cost savings, ROI, and outcomes that grow. We've also sought full accreditation from the CDC as an alternates diabetes prevention company, first of its kind for a precision health company like us. And so we've got best-in-class proof of what we do. Also, what's happening in our platform is we're collecting this incredibly valuable data set of both genomic data samples and lifestyle data samples over multiple years called phenotypic data. And it provides us with a real-time engine to apply more and more AI and machine learning to provide insights back to each participant to keep them sticky and engaged, which helps our subscription-based model. But also at scale provides us an opportunity to partner with drug discovery and pharma firms on what we hope to be a next-generation preventive therapeutic platform. We've been really commercializing with big innovators, big insurer and employers. We count JP Chase as a customer. Our good work with them has brought us to the first trialing of the Haven Consortium. That's Amazon, Berkshire, and JP Chase in the JP population with an evaluation year of 2020. We just rolled out with CVS Health's population over the summer after years of working with Aetna. We also work with Accenture as examples of that Fortune 500 set. We currently have 375,000 at-risk lives under contract, which fully exploited represents north of $100 million in revenue opportunity to Newtopia. We phase into those populations. So we're growing, currently executing about 20% of that opportunity with a 5x growth opportunity to grow into it. We've had fantastic growth since commercializing in 2016. We have a 3-year CAGR of 70% on active participants, 100% on revenue, 185% in gross margins, with a very strong balance sheet. We just completed a $7.5 million bought deal and have a $5 million revolving loan from a Schedule A bank here in Canada, providing us with enough cash to execute through the next 24 months, where we believe we're going to be cash flow positive midway through next year. And because of the inflection point, we decided to take the company public on the venture exchange in May of this year, right in the midst of the pandemic. We're currently trading at an EV to sales of about 10x. Our comp set is sitting at about 40x, largely in the US. So there's lots of opportunity to grow. And finally, we've seen COVID as this really fascinating lightning strike. Never wished it upon the world, but it's done two things. In many ways, it is shining a light on the problem of sick care and the fact that preventing disease is probably more important than just managing it. But also the fact that at the root, underlying this is that the individuals most impacted by COVID-19 around the world are those with chronic risk factors like weight, pre-heart disease, pre-stroke. And so we believe that while we're extraordinarily excited for these vaccines to come forward, don't let the vaccine fool you in that behind that timing, we believe there's going to be an epic tidal wave of chronic disease. And just think about it. How many of us have gained weight this year? How many of us have been sedentary this year? How many of us have had increased stress this year? All of those things are the early warning sign of metabolic risk factors leading to chronic disease. And we think we're incredibly poised with a differentiated offering to help reduce that risk for our partners and to hopefully really make healthcare about keeping healthy people healthy. Thank you.
No, thank you. And while you were discussing all of those things, I'm like checking off all the boxes. Yep. That's where I'm at. So this is the part of the program that if you follow Tech Tuesday, we call it the Inquisition in honor of Mark Francis, who has been the brain trust and child behind the platform and the template. So if I can ask all the panelists to return, I have a question that Mark had submitted earlier, and it's about your recent experiences with fundraising. While each of you has had recent successes with raising capital, and I recognize that fundraising takes effort, I'm curious to know from each of you, what part of the process gave you the biggest kick/boost? And did you get the shareholder profile and composition that you sought? Let's take it away in the order of presentation.
So I think we're probably seeing the peak and the trough, the highs and the lows, tailwinds and headwinds. From a WellteQ perspective, we started out the year on a fundraising journey, and I'm in Singapore today, but I was in Canada in March, and it was as I was departing the airport, the funding that we had raised on that trip was reassessed. And so that was the low. What then eventuated is that the knee-jerk reaction of the investor base that we had recognized the business underneath it, and that the issue was a health issue at its core, and that what we did as a business and as a sector was going to actually shine out of this. And I think that a lot of good health companies, and the three on this call here in particular, four with CloudMD, have proven that. So the kick, if I can interpret it as a kick against us, a violent kick, was certainly COVID in the late stages of funding round that commenced pre-COVID. But actually, that in turn turned out to be a bit of a favor because of the type of problem that it was, and the boost that came from that. There's a raft of names that have helped, and the beacon of all of this digital health sector in terms of value creation and ascension is Livongo. So if you look at the company themselves, they were hovering around $1.2-1.3 billion market cap down in the US during COVID, and then 6 months later they've merged for $18.5 billion. That is enormous. That is outstanding, and so that it does put tailwinds into investors and think that there's longevity in the sector, and that was a real help.
Thank you. Next presenter. Same question.
Raising during a pandemic, certainly an interesting experience. So we closed our pre-Series A in May. And, I think an important part for me was considering speed. So we had multiple term sheets. We had good visions and values alignment with two groups, Canadian groups, although we had U.S. interest as well. And a big part of that was that, they were committed to, closing due deal, everything within 6 weeks. And even though it was an incredibly uncertain time with COVID, I knew that we needed to act quickly and put some fuel in the tanks to realize, the opportunities in front of us. And certainly that's all played out very, very much to how we thought it would. So, substantial need for our platform, substantial growth this year, and having, not only the fuel in the tank, but also the backers that, are bullish and understand our vision and our mission was really important. So that's been our experience. Certainly as we go into 21, I think we're really, this year has been absolutely transformational for Curatio. If social wasn't seen as important previously, it sure is understood now. And that notion of social plugin and having that as a part of every single platform, especially when you're seeing, large M&A, has been really important. And just last note on that, if you look at the Livongo Teladoc, 18.5 billion merger there. Really what they're looking at is Teladoc being, telehealth and transactional, whereas Livongo was looking at the lifetime value of that patient. And that's really the piece that we bring in, is that lifetime value, that lifetime engagement with a patient. And so you can start to see, the real potential of the social aspect of it, which is, what you saw in that deal.
And the man on the move.
I do like to move when I talk. I'm sorry. I hope it's not distracting anyone. But
no, it's great.
I think my co-presenters have covered. I would say, our fundraising has been. These are long journeys when you're trying to innovate, and especially in the case of prevention, when you're trying to introduce something that largely just hasn't been there before. Unlike the telemedicine movements, which is effectively digitizing what's already been there, the condition management movement, digitizing what's already been there, the act of preventing chronic disease really hasn't been there. It's not what the sick care system does well in analog or digital, but it's also something that investors are just, I think, coming to a greater awareness of. No better time to go public in the midst of a global pandemic when the world is literally focused on preventing a disease. And so we've been really pleased with the ability to fundraise in that environment. And I think, as a relatively new public company, 7 months in, there's still lots of work to introduce ourselves, both in Canada and in the US and around the world. And so, we're exactly where we should be right now.
Okay, that's great. We touched a bit about on the pandemic. I don't think we've had a panelist on here that has not touched on the pandemic at all. But can you talk maybe a bit more specifically, how that's impacted you, and how do we come out of this COVID environment?
Well, what's interesting, and maybe I'll just throw this out to the panelists, is that the entire world now has had the opportunity to experience what it's like to be a patient, with a chronic condition or a rare condition, right? That sense of, isolation, if you've got a weakened immune system, you're not able to socialize in the same way. The entire world now has just experienced what it's like for many, many patients in the world. So, I think we're going to go into, 2021 with that appreciation, that empathy, perhaps. We've also seen, rapid adoption with healthcare systems. So, what might have taken, 6 months, a year in the past is like decisions are being made in 10 days, in 2 weeks, and adoption is prompt. So that has been accelerated in a way that I don't think will we're not going to have a backslide from that. So, the silver lining for COVID, I think, is really, it has accelerated very necessary, changes in terms of how we think about healthcare and well care, not sick care. How we deliver that, how we become more patient centric. COVID's just completely accelerated that, and I don't think we're going to go back. So feeling very excited for patients and their families looking ahead.
I think it's been that jolt that everyone was looking for in healthcare. FinTech have had it, insurance have kind of been on the wave for a while. Healthcare just did not take technology, and overnight we were forced to use it because it was just unsafe to go and see the tried and true method of the GP or the specialist. So I think it's been a benefit. That's going to be one of the benefits. I agree with you, Lynda. I think that's the great call out of all of this. And Jeff, you wouldn't wish lightning to strike the world, but it has, and it's a great jolt for people to realise that there is technology of efficiency out here. The other plus side to all of this is that it's reminded the world that health is important. And yes, the shiny pair of shoes or the career advancement or that trip overseas is important, but you can't do any of it if you're not healthy. And you can parallel being a patient inside a hospital, but you can also almost draw a parallel that it's incarceration. You're in your zone and you're locked, you can't leave. And this is not going away anytime soon. Unfortunately, with that, it does introduce bigger risks. The hangover of the COVID response and the treatment is going to be exponentially larger than what the health impact was of the disease itself. And that's scary to think because we've had so many deaths from COVID, but we've got behavioral issues. You've never been exposed to your spouses for such continuous periods of time. So you've got, baby boom in some respects, but you've got domestic conflict and sometimes violence. You've got financial uncertainty. You've got different coping mechanisms, not always healthy. And one hospital, there's a state down in Asia, they had a 27 increase in admissions from self-harm since COVID, 27 times. So it just shows that we're not geared up to respond to this type of living. And unfortunately, we need support. It needs to be ongoing. And it's social connection, it's disease prevention using biomarkers, and it's just getting insight and helping people realize that they're supported. And it's an ongoing journey. It's not a one-off solution.
Yeah, no, that's great. You highlighted a lot of different things there, and carrying on just from that theme of the stressors in the environment. And, we talked a lot about, and you mentioned social support. And what is the role of social support, either digital or, face-to-face in chronic disease management? And what are the benefits that come from allocating real life coaches to people? Because that's part of all of your platforms. Yeah, maybe start with Jeff.
Yeah, fair enough. And I think it's fundamental. I think we heard humans are social animals, and they are, and humans respond to humans incredibly well. And I think it's those platforms that have been able to bring together the best of human and the best of technology. The real tech-enabled services that have been able to largely get a lot of the clinical trial work, the proof of concept work, and the cost savings done, because it would be so easy if this were just a tech-only solution, and tech's got a huge role to play. But I think it's at the intersection of technology and human. It's that bringing the best together where magic happens, because you've got both the opportunity to inspire, to educate, to inform, to hold account in a way where with humans and technology that can be real magic, and it can scale incredibly well, unlike some only tech or only human just can't do. So I think it's been fundamental to our success, and I believe that, again, applying that formula to prevention, to keeping people healthy as opposed to just trying to manage illness, it must be the direction forward. And again, I think COVID has shown us all that this year.
definitely the wings of change on prevention seem to be there. I think governments and a lot of more focus are having a lot more focus in that area, realizing that the system's been basically built on acute care, and really, one needs to have data over time on patients to let them, manage their conditions appropriately. It's not the, once a year or a couple times a year check-in. Now, and where can we look for the best solutions and most satisfied customers when you're in this, and what can we kind of learn from the feedback that you're getting with the patients that you're helping? Like, where are the areas that the solutions aren't quite there yet, that they still need more acuity, or they need more, they need some more robustness in order to really get that patient satisfaction and outcomes at the level that we'd want them to be at?
I'll jump in here quickly. I think we've probably all got 5,000 or 10,000 responses to that question, but there is no one size fits all here. There is no silver bullet for health in the same way that you need a physio for musculoskeletal and a GP or a nurse for different aspects of health. You add the different regions and cultures and languages and comorbidities together, and I think that there is just so many combinations of what's required out there. We've got a long way to go. I think we've made some outstanding steps this last 6 months, but we do have a long way to go. I think one of the areas that is certainly not as advanced as others is nutrition. To be able to quantify, control, and measure and utilize that information as a feedback loop into the personalization and coaching and support that you would then in turn require. We're still, at the start line for that, compared to where, if you look at activity was 5 or 6 years ago before the Fitbit generation, the Apple Watch, the Garmin. Then if you ask someone how many hours sleep did you have, what stages did you have, and how many steps per day did you do, you'd get a blank look. But through that general population adoption of the quantified self via wearables and gadgets, I think activity has taken a big stride. For me, mental health and understanding mood and depressive or burdensome symptoms is going through that same ascension right now. And it's so critical because it's upstream to every single chronic illness out there. One of the biggest pieces around this, especially with weight-related and metabolic type illnesses and risks, is that we need to get on top of nutrition. And I think that's the area that's going to see a big jump over the next 3 or 4 years.
Yeah, I think about something that Mary Meeker touched on. I think it was last year in her report, and that 10% of health outcomes are attributed to clinical care. 10%. The other 90%, right, come from the social determinants of health, so social, environmental, whether that's support, socioeconomic, region, environment. So health is a much more holistic enterprise than we're considering it, right? Or that we've considered traditionally. And when you think about it, it's a little bit ludicrous that you can go to buy a pair of winter boots, and the retargeting and the microanalysis, the social listening, knows what to recommend to you in terms of your boots based on who you are, what you've bought previously, your age, your spending power, etc. But we're not doing that for healthcare. And that's just ludicrous, because if you don't have your health, you don't have anything else. So, other than the planet and your health, these are the two, most important issues facing us. So I think the gaps are really it's a massive cultural shift. I hope in the return to normal that we do think very carefully about what collective health looks like and how improving health on a massive level, on a country and continent basis, is one of the very key solutions to solving our future problems. So whether that's spending on chronic disease health, whether it's the overwhelming burden of caregiving, that tsunami of caregiving that's coming, the mental health issues that we're facing. If we don't address these, and if we don't use the very technologies that are in our hands, then we're not going to see the outcomes improvement. So, I'm hopeful that is that we've made a tidal shift. I agree with my other speakers here that personalization, the personalized use of technology, the micro-targeting, personalized preventative health is absolutely key to where we need to focus. And, I've always believed that you can, the 3 Ps, you can build a business that is good for profit, good for people, and good for the planet. And I think that's the exciting part about digital health.
Yeah, but maybe I would just sort of take a different frame, because I agree wholeheartedly with everything that's been said. I think there's also an onus on the innovators to there's some business model changes got to take place, right? If we want outcomes, then groups have to go at risk for outcomes. If we want to tie technology and services to usage, then that's got to be part of the model. If it's just another layered on capitated model, adding more sort of bloats to an already bloated worldwide sick care system, I don't see where the change takes place. But triple aim takes place when there's an alignment of economic interests. And again, as I started, the reason we have a sick care system is because everyone gets paid in treating sickness. If we want a healthcare system that that is going to be about prevention, then everyone's got to be paid on preventing. And that also includes the companies who are offering those services. And until that happens, I don't see any real meaningful change that's going to take place.
Yeah, no, that's a great point. I think given Barrington's here, we're getting short on time, and I think we're out of time. But I just want to thank all the panelists today. Very insightful talks. I've spoken to you all individually outside of this, and I can go on for hours about this kind of stuff. But thanks again. I hope the crowd got something out of it, and I'll turn it over to Barrington.
Thank you. And thank you, everyone. Just a quick note. Our moderator, Mark Kohler from CloudMD, those were mostly his questions. So please don't think I was asking, because I don't want to take credit. Very, very knowledgeable person, and CloudMD is a great company and organization. So I'd like to thank Scott from WellteQ, Lynda from Curatio, Jeff from Newtopia, as well as Jason from KASCorp. And may everybody have continued success in expanding your business. Thank you to the attendees for your time today. Go to the company websites. Go to their LinkedIn pages. Go to their Instagram and Facebook. Learn more about the companies. And if you have a lead for them, connect. Until next week, when we have data and diagnostics, we wish you well and stay safe.